Welcome, everybody. Thank you all so much for being here and taking the time to attend part two of Reimagining Educational Spaces for Black Girls. My name is Tanaj Moody. I'm the Director of Capacity Building and Learning at the National Black Women's Justice Institute. For new folks that are just joining us and for folks that have been following our journey for some time, our mission is to research, elevate, and educate the public about innovative, community-led solutions to address the criminalization of Black women and girls. And we envision a society that respects, values, and honors the humanity of Black women and girls. And we also understand that, taking accountability for the harm that it's inflicted and recognizing that real justice is ultimately about healing. And so for folks that have joined us in our first part of our webinar, welcome back. And for folks that are just joining us in the second part, let's catch you all up. So catching you all up, in case you missed part one of our session last week, we recently launched the CARES initiative, which stands for Creating, Affirming, Responsive, and Equitable Schools. The CARES initiative is funded by the New York Women's Foundation and the Tao Foundation. And the CARES initiative is a national training, assistance, and resource hub for schools, educators who are striving to implement trauma-informed, culturally affirming, and gender-sensitive policies and practices that are ultimately fostering safety, belonging, and opportunity for Black girls and gender-expansive youth. In last week's webinar, we launched the first tool to be added to our resource hub, which was called the CARES Mental Health System Assessment Tool, which is currently available on our website, and we'll be dropping the links in the chat box for you to share, to download, and to review. So this tool is our response to ending school pushout and ultimately centering Black girls' experiences, needs, as well as their concerns. To develop this tool, the National Black Women's Justice Institute reviewed and consulted the existing landscape of mental health assessment tools and resources on schools' mental health systems. And to do this, what we did was we convened with two advisory councils, one that was comprised of young Black girls and the other of professional subject matter experts. And we conducted listening sessions to support and guide the development of the tool itself. And today, we have the pleasure to dive deeper into this conversation from last week with the expert subject matter advisors who supported the development of this tool. And we're going to be hearing soon from our incredible advisors, some of them, not all of them, but some of them who are going to be sharing their insights on the development of the tool and why and how this tool supports the unique mental health needs of Black girls in schools. I want to encourage you all, if you have questions, please drop them in the chat box throughout the conversation, and we'll try to answer some of them during the webinar if time permits, and then some afterwards if time permits. And then any questions that we may not get a chance to answer during the actual webinar, we'll answer those afterwards. So what I would like to do, and for all of you to join in the chat box, is we have two amazing guests who are joining us. And so if you could just put in the chat box an emoji or some snaps or some claps on welcoming our two panelists who are going to be joining us, but not at the same time, y'all. But both of our panelists are going to be Dr. Venus Evans Winters, apologies, and then Dr. Janika Fairley as well. To start us off, I would love all of you to give a warm welcome in the chat box to Dr. Venus Evans Winters, please. I see some emojis in the chat box. Dr. V is the founder of Planet Venus Institute and a visiting professor of education at The Ohio State University in the College of Education. Professor Evan Winters has been a clinician in private practice for nearly 20 years, y'all. And as a scholar activist, draws upon Black and Indigenous ways of knowing to help women and girls and those part of the global majority heal from racial trauma and gender-based violence. Welcome, Dr. V.
Welcome. Thank you. I'm so excited to be here, and I am so ready to release this tool because I know right at this moment we need it.
Absolutely. It's a pleasure to have you. To start this conversation, Dr. V, I wanted to begin with you. As you know, when we were developing the CARES mental health tool, we were reviewing, right, the existing landscape of what are the current mental health system tools available right now, as well as what are the resources available for schools. And one of the mental health systems that that we reviewed was the Wisconsin's framework for comprehensive school mental health. And for many folks who are on this call, if you don't know, Wisconsin's framework for comprehensive school mental health is a trauma-sensitive lens that includes guiding principles around safety, trustworthiness, choice, collaboration, empowerment, and cultural responsiveness, and considering all of those aspects, into the school. However, within the CARES mental health assessment tool, we really developed our own practices and resources, as well as our own guiding principles, right? That have included what we have seen a lot of tools not include, an intersectional framework that is really tailored to Black girls and their mental health. And so to ground us in this conversation, Dr. V, with your expertise, can you describe the current landscape of mental health assessment tools and some of the specific gaps that exist in addressing the mental health needs of Black girls?
Yes, Tanaj, thank you for that question. I do appreciate you giving a background on some of the tools and assessments that have been attempting to address issues around trauma and what's generally called in the mental health field culturally responsive. Now, of course, those of us who are on the educational side, we understand culturally responsive as a set of curriculums, pedagogies or teaching practices, as well as school-based policies. And so what has happened, I would say, again, thinking of the landscape, probably what has happened over the last 10, 15 years, I believe that the mental health profession has also tried to address issues around being culturally responsive. So what are the consequences when we don't consider people's cultures or particular backgrounds? And I could tell you as an expert in the field, I've been in higher education now as a professor for a little bit more than 20 years, but I've been a clinician just as long, but I was kind of doing that work in the background. Addressing some of the issues that we've done here as an advisory group and also doing the research behind the CARES assessment, right? And so what I would say is what a lot of people don't know, what they're going to learn today is that although we've tried to put a lot of emphasis around culturally responsive mental health services, we're not quite there yet. And some of it is because it does lack an intersectional perspective. And so when I think of intersectionality from a mental health perspective as it relates to Black girls, young women, and femmes, we're trying to think about both their multiple vulnerabilities, their stressors, and how those stressors overlap or interact, right? So when I say interact, I'm thinking about, imagine you have a pot, you have water, you add a little salt. Look, some of us hungry, it's dinner time. You add a little salt and then you turn up the flame, right? So you have all of those elements coming together to cause the perfect temperature, right? So I think of that as overlapping stressors. But we also have to think about systematic failures or where girls fall through the cracks, right? So Black girls fall through the cracks and other girls of color. So we have multiple vulnerabilities, interacting stressors, which is a natural part of childhood and adolescence, right? And young adulthood, but also we have systematic failures, right? And so when we're thinking about our CARES tools here, where we started, we got the landscape, understanding that bell curve, the myth of the bell curve. Sorry, I'm starting to sound like a nerd, but it did historically. It started with what were the needs, the psychological, emotional, and learning needs of white males. That was the norm. Then I would say somewhere around the 90s, late 80s to mid 90s. I'm thinking about, like, for example, research coming out of the American Psychological Association, the American Association of Women. There was a large focus on girls. So the norm, think of that bell curve. Then when we started talking about gender and not just student identity or young people's development, it became the norm was, what are the needs of that young white girl or young white woman? And so then, of course, many of us coming out of both the cultural traditions, the feminist traditions, anti-racist traditions, we're in these mental health spaces and we're like, I think this tool is incomplete. So no matter how great that clinicians or that mental health experts disposition is to Nudge, and I want our audience to really understand this and hone it in. It's not so much about the disposition of the counselor, the psychologist, the social worker, the psychiatrist, because remember, with CARES, the one thing we're doing here and with the National Black Women's Justice Institute, we're also trying to understand what are the social, emotional, cultural needs of Black girls that are affirming, right? So it's not just about disposition. There's a lot of people who have good intentions. But then when we bring all of our clinicians together and our researchers, policymakers, we're saying, uh-oh, what if the instrument is flawed? If the assessments and the evaluation tools, the other mental health tools, even our prevention, intervention, products, projects, whatever, processes, even if those tools are flawed, it's only so much that your psychologist, psychiatrist, social worker, school counselor, school psychologist can do. And remember, here we're being intentional on naming it. That's a part of our tool, right? Especially with our youth advisory project and the assessment itself, is naming what is the work of all of these people. It is a lot, right? And so we need to look at disposition and the actual tools that we're using. So you can have the greatest tools in the world. If the clinician and practitioners, even the teachers, right, any adult staff members, et cetera, that's working with young people, if they don't have the disposition, there's only so much you can do with that tool, with the results of the tool. However, you can have the greatest person in the world, and if the tools are giving us the wrong answers, the wrong, asking the wrong questions, then we can't provide the proper interventions. And so that's the landscape of the assessments, the evaluations, the intervention tools that we're using. And that can be anything from a psychological evaluation. It could be anything from a set of practices or curriculum, or it could even be like worksheets, right? So things we kind of take for granted and we assume that they're true, they're accurate, or another way of saying it, valid. So Tanaj, was that a whole lesson?
I feel like,
Research.
again, I'm taking mental notes. I hope everyone in the audience is taking mental notes, writing notes, because all those gems. And then, making really great point of just tailoring, right? Making sure that the information, the practices, the interventions are tailored, right? Because we're not a monolith, right? And I think that's really important to note, is that individualism when it comes to our experiences is very important. And I think that is what we're talking about, right? And so, Dr. V, like in the tool, we have those guiding principles, right? And these guiding principles that are within the tool, for folks that maybe haven't had a chance to check out the tool just yet, within the tool, our guiding principles are infused in every part of the domain intentionally, right? These guiding principles, for example, supporting rest of Black girls, building trust with Black girls, centering Black girls and their strengths, their agency, right? How are we doing that in our mental health assessment tools? And those guiding principles are infused in each part of the domain. And, the advisory councils worked on making sure that these things have all been incorporated. Could you talk a little bit on like a specific example on one of those guiding principles within the CARES mental health assessment tool. For example, maybe the adultification bias that was developed within the tool, and how that helps to guide folks with the actual assessment.
Oh yeah, I think that I can go in so many directions with that. So what does this look like? Can we take both examples? Rest, what does that mean? And also, can we address adultification? I think that could be a whole webinar in and of itself, right? But
We can.
but I'll keep it. So let's start with rest, because something that I've learned, as a clinician, as a formally trained school social worker, but even, now, looking at some of our liberatory practices, which is a part of the framework, again, for, the organization, for NBWJI. So that's the perspective. We have our framework, but so does every other assessment toolkit and model. So let's be clear, because you named the Wisconsin one, theirs would be trauma. That's the framework, right? So ours are gender and culturally responsive practices and approaches. So let's just take rest. So as an advisory council, when we're coming in with these sets of experiences, living in our bodies and working and serving with the people whom we serve, we're also looking at this from an interdisciplinary, transdisciplinary, and diasporic perspective, as well as developmental, right? So did you see how that happened? And again, I want our audience, because all of us, we have to go back to Instagram, the TikTok. I don't do the TikTok, but the TikTok. We have to go back to YouTube, and we have to go back to the communities that we serve, the girls and young women and femmes whom we serve, okay? So that's the other part. We have to look at the social historical context alongside developmental stages. So when we're thinking about rest tonight, you asked for a specific example. Keep in mind that we're serving young people who are going through their own developmental phase. So imagine if you have a girl, the onset of puberty, as we know, it's starting a little bit earlier. So gone are the days when puberty started, say, on average at 12. Now we're looking at the onset of puberty, again, depending on the environment, etc. It can be starting as early onset, on average, is now down to 9. So we know what average, because I just explained these curves, right? So average can mean 8 or 9, or it can mean 10 or 11. The one thing we know is coming down. So guess what? These girls are going to need to rest differently. Their bodies are going to require something differently in 3rd, 4th, or 5th grade than just a decade ago, right? But also, tonight, let's be honest. We think about rest within the context of a larger social climate. So we know we just got hit, with the latest election results. I don't know if it depends on whose side you're on, you just got hit. But I mean, we've seen that, right? So that caused a collective response, right? So, but also we know that there has been, I wouldn't say an insurgent of violence, but it certainly has been an increase of visuals of violence across social media, mainstream media, etc. And so our young people are watching this. They're also laboring. So many Black girls and other young women of color, they also tend to enter the workplace at earlier ages. So you're not just going to school, but you also may be working a part-time job, or you may be helping out with family care, which is typically the case of Black girls, especially those from working class and low middle class families. So now you may be holding down a job, you're helping with the elderly, you're helping protect and provide child care for the younger kids. And also you may have more domestic related labor compared to your, peers who are not Black or from, different socioeconomic statuses. So keep that in mind. And all of this is happening developmentally while trying to learn and attend school safely. You need rest. Okay. And then remember, from a trauma-informed perspective, I'm gonna give y'all a word. Just put it in your notebook. I'm always telling people to take notes. Okay. I'm the oldest child. I'm the oldest daughter, right? The middle child, but the oldest daughter. So I've been teaching for a long time, right? At least since I was 5 or 6. So I always say, put this in your notebook. Look up epigenetics. So if we're going to have a trauma-informed lens that's accompanied with, right, a gender responsive and a culturally affirming assessment and tool, we think about rest also for the simple fact that we know that our mothers and our grandmothers and our great-grandmothers were denied rest and restoration because they were forced into hard labor. Right. And so think about that. That's influencing our young girls, not just how they experience puberty, but also how their bodies adapt to their environment. So rest is a whole human right, but it's also a mental health hygiene practice. So that's just one example. So already we have a group of girls who may require more rest than the typical child or adolescent. Okay, so remember, we're also being very careful of overgeneralizing, but we also do have to think about typicality or what might be the case, with the particular young people that are being served. So that's just an example of rest. Now think about adultification. I've already given some examples, and I usually typically try to distinguish, but I won't for time's sakes. The difference between parentification and adultification. I won't go there. Just say parentification is somewhat a part of adultification, but if we focus on adultification, you have to think in many cases as early as the age of 5 or 6. The research has shown that Black girls actually have there are expectations put upon them that we would put on older women, on adult women. And that could start as early as 5 or 6. Could you imagine? So not only do they have behavioral expectations, but also, as Dr. Monique Kusin has proven, even in her research and in her tellings, right? You have a lot of Black girls too who are they're not only expected to be more and do more and know more, but they're also left unprotected. So even some of the examples I gave, right, just how they're treated at school, you know better. You're not being a big girl. Now you know it, right? So they're given more. It's funny because the research actually shows too that Black girls, they're not given leadership roles in schools, right? So think elementary school, think middle school to high school. They're actually given domestic or chore-like responsibilities, such as erase the board or carry those books down the hall, right? Or move the desk or clean up the classroom. It's not like they're saying co-facilitate a lecture, right? Help me write this curriculum, right? Or, are you in charge of the class for the day? How do you want to learn this algebra? Okay, so they're still given these traditional stereotypical roles in the classroom. But then on top of that, if they're left unprotected, according to Dr. Kusin's, research and writings work, right? What else is going to happen too is that they're being exposed to more adult content, because the assumption is they already know this because this is what's happening in their homes, their neighborhoods, or even on, in the media or social media. So there are assumptions made about what they know, which then leads to them knowing more than what they probably should as far as adult-like content, right? But then they're left unprotected, so they're exposed to more, stressful or traumatic ideas and interactions, right? And words, etc., and stories. And so again, now some of this is, again, I like to look at it from the framework of family, communities or neighborhoods, and schools. Now, with our particular, tool, the assessment here, what we're asking people to do is to see how we can take some of these ID specificities that we know, again, from a social perspective, a historical perspective, a cultural perspective, a gender perspective, a developmental perspective, as well as social emotional perspective, and see how can we do our job to allow girls the right to rest and the right to protections that all girls and all children are accorded, right? And so when we think about this from an assessment perspective, Tanaja, I'm gonna wrap this up, right? So whether we're talking about our tier 1 or tier 2, tier 3 interventions, we're thinking about mental health and wellness as a part of the whole child, but we're not going to ignore who they are as gendered beings, right? Gendered, but also who they are as cultural, social actors who are part of a larger environment. And schools, dare I say, schools are political. Schools are political. So our girls may not be extended the same right of rest in a space that has traditionally ignored the needs of Black people, girls, and people who are part of the LGBTQIA plus community. So we built this in the toolkit. We built this within our assessments as far as a support model for overall mental health and wellness and well-being.
Thank you so much for sharing that insight and providing background on the social emotional factors that all are completely necessary, as well as often overshadowed, right? And really not considered on just like a human level, which is so important. And so, really being able to share the insight on these different guiding principles that are infused within the domains of this tool is really important to note. I want to dive deeper into the actual domains, right? For some folks that may not know what we're talking about, there's 6 domains within this CARES tool. There's teaming, which is all about how to create a multidisciplinary approach to address the mental health needs of Black girls. There's the needs assessment and resource mapping domain, which is about making informed decisions on schools' current and necessary supports and services. Like Dr. V mentioned before, there's the multi-tiered systems of supports. There's that tier 1, tier 2, tier 3. You're around like evidence-based processes and policies and practices to really promote the mental health of Black girls. And then there's mental health screening and referral domain, which is all about early detection and referral strategies for Black girls who may be experiencing mental health challenges. The last 2 domains that are important to note that are within this tool are data and impact, which is how can schools begin to utilize their current data to evaluate the needs as well as the progress of Black girls' mental health. And then, of course, importantly, funding and sustainability. How do schools really understand the diverse funding sources that are available to support the sustainability of the mental health programs within their schools supporting Black girls? And so all of these domains that I've mentioned, similarly to what Dr. V mentioned about the guiding principles of adultification or supporting rest, right? Like those are just some of these guiding principles that are really infused into these different domains that schools are utilizing to assess their mental health frameworks and policies and practices that they are currently using. Dr. V, you touched on a little bit on the tiered systems, right? And so I want to just take a moment to briefly describe for some of our audience who may not be aware of, what a multi-tiered support system is, so that folks can understand, like within our domain, how this is being utilized. Can you speak a little bit to how a multi-tiered systems supports can be used to address the mental health needs of Black girls in schools and the benefits that it has in promoting their mental well-being?
Yes, yes. And so I do want to back up a little bit. I was thinking, oh, thank you, Tanaj. You're so bright and brilliant. So thank you so much for mentioning the domains, right? So think of the domains as interacting with each other, right? And I think that's very important because I think as an advisory council, and while we were, putting together, the what we see here is it was a lot of research that went into this and a lot of brain power, right? A lot of Black girl power. And so the domains, we have to think about them not as separate, right? But again, as overlapping and as what's the word I want to say? They're informing the other. Right. So we think about needs assessment or community mapping or community needs assessment and community mapping, right? Screenings, etc. So like we can't separate the child from the experience with their counselor or student support services, nor can we separate them from, who they are as cultural beings. So think about it that way. So that's how these domains are set up. So when we're thinking about the multi-tier system, we're also, I think what we were intentional about was also not just naming the vulnerabilities or the structural failures, right? Because that could be still a deficit model, or it could be, you know, steeped in like a pathological perspective, for the lack of a better term, right? That's one of the challenges we're talking about trauma, especially. It's like, wait. But I think the multi-tier system of support, it reminds us of the agency of Black girls historically and in contemporary times. So not just who this child is as an individual, but also who they are connected to as a person who's a part of a larger social environment. So the person environment, right? So we have the girl, the Black girl student, but she also has we want her to be able to access a positive peer group. When we think about it from a multi-tier perspective, we want her also to pull on the resources that she does have in her community, right? Including schools, but also maybe, you know, after school or extracurricular, co-curricular activities, other girl-centered programs, right? Because we found that to be a part of resiliency fostering factors. But we also want the girl and any helping professionals to help them locate another positive adult in their family, in their community, in their neighborhood, or in their school, right? We found that to be a part of resiliency fostering factors. And also, we want the people, the helping professionals who are serving the individual girl or the group of girls, right, to also understand that there are support. So we're moving away from this savior mentality, or only one person can save this this student. And so that's why I wanted to put it in perspective. So that's why we have the domains, but that's why we also have a tier system. So when we think about tier one, it's focusing on universal mental health promotion. So something that I always say, keep in mind, this is when we pull out our notebooks again, our journals, right? So this is a whole education. So keep in mind that one individual cannot save be saved on their own. We're part of larger communities, and that's usually how we heal. We heal collectively. It's a myth that we're healing on our own, by ourselves. That's not true, right? We heal in community. And so we want, this is the fact that I wanted to put out there. One thing research shows is that girls are more likely to disclose feelings of discomfort or abuse or manipulation to another girl or friend. So keep that in mind. They're least likely to go to an adult in their environment. They're actually more likely to disclose to a sibling or a friend. So as a part of our, tier system, multi-tier system, the care program or assessment is that we actually want to teach not only that young person or that helping professional, we want to teach others around them. So we will have mental health training and programs for that are like peer related, right? So peer support programs. We're going to teach girls and their friends and family members and other students. I just named these different helping professionals, right? We're going to give them the vocabulary. We're going to help them discuss for themselves, name for themselves, what does it mean? What does mental health mean? What does mental health look like? What does mental health and well-being look like? How will we know that you're mentally well? How will we know that you're not feeling so well? How do we know that you need mental health services, right? Interventions. So just overall mental health promotion throughout the school environment, and it becomes a part of the learning climate, the school climate. And tier two, it does offer, we try, prevention as well. So it's intervention, but think of it also as prevention. So we want to prevent dis-ease, right? We want to prevent, but then, we want to, intervention, or we want young people to have access to services, before the problem becomes bigger than what it is. And so the way that I like to think about that too, Naj, is, I always tell young people, think about this. We have to know where we need to go for help for a particular issue or problem. That's the same thing in mental health. Okay. So when I have a toothache, I don't go to my gynecologist. Facts, right? Right. So I need to know which expert to go to, which person can actually help me with this problem, right? And so that can be a part of the prevention, but then also this is the assessment part. Okay, so what do you need? How can we help you? And also, what do you believe are the next steps? So again, the agency and bringing forth the power of the child and any support networks, okay? And then tier 3, it will target students, with serious concerns, because I think that where we're dropping the ball on a couple of ends as a society. On the one hand, sometimes we don't know what professionals to go to. We still are grappling with issues around the stigmatization of mental illness, disease, or dis-ease, right? But some of this too is just lack of education as a community. We finally may have access to mental health services, but we don't always have the vocabulary. Sometimes me, even as a clinician, for years, I don't have the vocabulary because sometimes, these different professional organizations, they didn't necessarily have us in mind when they were coming up with these tools, and sometimes they don't. It's not a good cultural fit. The other issue we're dealing with, which you're going to see in these multi-tier systems, is we're trying to prevent and make up for structural failures, right? And so meaning that we know, and we have to name the elephant in the room, trauma has become the scapegoat for systemic failures in education. So in many ways, the CARES mental health assessment as a tool, it also serves to buffer, you hear me? It serves to buffer more educational neglect and failures against Black girls. So it sounds like you all we're offering, we're saying a lot, but what we're doing is we're trying to offer more with less, and also ensuring that it's not only gender responsive and culturally affirming, but it's also, even more importantly, is serving to protect the whole child, right? So to bring forth their power, while also protecting the girl and other girls within the community. Yeah. So Tanaj, did I answer that question?
Yeah.
Okay, because I
I
think the
I
context.
break down what you just said. Trauma has become the scapegoat, right, for systems failure. And I've never heard someone put it in that way. I wrote that down. Thank you for that. And how this
Yeah.
tool is really serving as that buffering point.
Yep.
That was beautifully
Mhm.
said. Thank you so much for, going over these three different tiers around the universal support, the early intervention, and the individualized interventions that are within this tool to really support and address the unique needs of Black girls' mental health.
Yeah,
I
because
want
some of
to,
these series, I want to be clear on. So with tier 3, we're not saying that trauma does not occur, right, Tanaj? But we do want to make the point that we're trying to buffer, and we understand that we cannot allow schools to systematically punish and push out girls who we know for sure would benefit from mental health services.
100%. Couldn't have said that better. That's exactly the importance of this tool. And that's why the tool was developed is this is our response to girls push out. So thank you so much, Dr. V, for sharing that in-depth explanation around the MTSS support systems, because that is a really important domain within this assessment amongst all of them, that also infuses these different guiding principles. We're going to switch gears a little bit. I'm going to bring in Dr. Fairley into the conversation. And so, for folks that may not know Dr. Fairley, I would love to do a brief intro. Dr. Fairley serves as the Senior Administrator and Counseling Support Programs for New York City Public Schools, and is an instructional leader with over 2 decades of experience in school counseling, literacy instruction, special education, adult education, school leadership, as well as systems level educational administration. So thank you so much for being here, Dr. Fairley. As you know, Dr. V shared so many gems around the domains, the development of this tool, and the insights that your expertise, as well as amongst other advisors, have provided for this tool. And so I wanted to really touch base with you in your perspective, right, on parts of the domain as well. And then I really want to also kind of dive into the actual implementation of the tool itself. And so, could you talk a little bit based on your experience in system level education administration? What is important for audience to know around conducting a needs assessment and resource mapping within schools? And for folks, I'll just repeat this again. This is also another level of domain that Dr. V had mentioned earlier that all really interact with each other. They're not separate. All of these interplay with each other. So yes, Dr. Philly, could you talk a little bit about the needs assessment and resource mapping domain and how this can benefit schools in addressing the mental health needs for Black girls?
Absolutely. First, I want to say thank you to Naj and everyone at NWBJI for answering the call. I would say it's a clarion call, but it's a call that you all recognize and that many people don't. That there is a need to address and amplify the voices of Black girls and their experiences in every level of education. And a lot of assessment tools, as Dr. Evans Winter mentioned, they were developed, and unfortunately is developed with the thought in servicing white males primarily. And historically, that's who developed the tools and that's who the tools impacted. And we all don't have the same experiences. We are not a monolith. So this assessment tool, it's so in depth and it answers so many areas and focuses on pieces that people may not see or may not notice, that you need to look at that in order to address the needs that's there. One thing, as far as the needs assessments, it's important for school communities or people. And when I say school communities, I think of not just the student, but we're speaking about every staff member, from the first person you see when you walk in the door to the person who is assisting with the grounds and the maintenance. We're also thinking about the families who come in that building, and families, because they have three or four jobs and other places they have to be. Physically, their not presence is not in the school, but they are part of that school community. They interact with our Black girls, and we need to make sure that we're servicing them as well. So this assessment has to look at, and it looks at the impact or the end result, and thinking about who Black girls become, Black women. And I looked at data tells a huge story. You look at the story that data tells and what we can learn from it and how it's going to impact our Black girls. Looking at, for example, the National Institute of Health, they have a book on the outcomes of women of color. Specifically, some of the outcomes for Black women speak to the issues around systemic pieces that legally have been placed in our society that oppress Black women and have for decades. And it impacts stress factors, which then promotes aging. And that does not just show up, those stress factors, in adulthood. It starts for our Black girls. As Dr. Winter mentioned, when girls are as early as 6 years old, and probably even, I'm going to say, I know factually earlier, as we have in our school system 3K. So if a child is three by December 31st, they're eligible to be in our schools. And unfortunately, in some of those classrooms, our Black girls are not provided from all educators with the same level of care and respect as their counterparts at times. So it starts at that level, that they're held to a different regard. So using this needs assessment, schools are able to really dive deep and share with their educators, here's what we see what we're doing that's working well, and here are some areas that we need to address. And we need to look at those areas and have true conversations as school communities about what we're not doing, making a plan for it, truly making a plan of how do we implement change, how do we hold up the mirror to say, let's take a look at what we are doing and what we're not doing, and calling each other out and making the change. Also, it's important for school communities to include the voice of families as partners. Families may be parents, grandparents, whoever is the custodial person who's helping to take care of that child, and they're part of the community as well. Sometimes people leave out their voice and forget that their voice is just as important because they don't just come in and leave, but they're part of the conversation as well. So that's important. To make sure that we're hitting all the parts. It's part of the map, the resource mapping within schools. And I think we really can address it by making sure that we listen to everyone's voice. Everyone's voice is there, everyone's voice is heard and amplified. It's important to make sure voices are amplified.
Thank you so much, Dr. Fairley. And you said a key word, amplification of voices, right? Which is actually one of our guiding principles within this CARES tool that is infused within these domains. And the other thing that you were just sharing was around the teaming aspect of things, which is another part of this tool, right? We have teaming as one of our domains, which is all about creating this multidisciplinary approach to address the needs of Black girls, which includes family members, community members, right? School administrators, licensed social workers, educators, making sure that all voices are there at that table. So thank you so much for highlighting the importance of the resource mapping domain, as well as the needs assessment. And, as we mentioned earlier, these domains are infusing these guiding principles that we had mentioned. And each of these domains, for folks that are just catching up into this conversation, each domain includes promising practices that are really applying guiding principles within each of these domains, such as the needs assessment domain, such as the multi-tiered systems of supports domains. And so I know for many folks on this call may be interested just in the application of the tool within their school environments. So Dr. Fairley, within your role as the Senior Administrator for Counseling Support Programs, how do you, in New York City Public Schools, how do you envision the integration of the CARES tool, right, into the existing mental health frameworks within New York City Public Schools? What steps do you think are essential for successful implementation of this tool?
That's a great question. There's a few pieces that speak specifically to, I believe, systems that are similar like New York, where we have multiple offices and programs. And I will share some of those, but I think it's also important to recognize that regionally we're all not the same. And I say why that's important, and I will come right back to what New York City, what we're planning to do. But I'm sharing that because as an educator, I've had training and worked in different areas, being in the Southeast in Mississippi. Did a lot of schooling there as well as in Oregon. So the differences of being in different areas, I realized regionally, we have different needs as far as rural communities or ones that where the diversity is not as strong as in New York City, where in our large school system, we have several offices and initiatives where we're placing and will have the opportunity to have the CARES initiative, the tool used. For example, we have a Chancellor's Advisory Council that has girls to actually speak with the Chancellor and highlight issues that are happening within schools and here amplifying their voice. We also have a human trafficking awareness student ambassadors in high school. So they're also able to share and we're able to pull out different pieces of the tool to use it with them, as well as our GSA clubs for our Gay Straight Alliance. And we're having a mental health summit for girls. We're doing one for high school, and we also have plans to have ones for middle school and elementary. So, using the responses from the framework and the framework as a guiding tool, we're able to see, okay, what does a mental health summit, should it look like, and what does it need to include based on the responses from the tools of the CARES assessment. We're also able to share it with school communities by district, where some districts we have higher levels of girls of color, specifically Black and brown bodies, as well as other districts that do not have as high as a percentage. However, the need is still there. If there's one student who's present, That need is there to make sure that their voice is heard and their experience is cared for. And that's what the initiative does. When I think about other districts, some of the tools that I just shared and initiatives we have in New York, and we have others, I've spoken with colleagues in other states, they don't have that. And they're like, oh, wow, I wish if we only. So it's really just taking the tool to saying, okay, how can we share this information with our educators, be it with, if it's a school department of social workers, school counselors, and school psychologists, providing them with the training on the tool, how to then take that into school communities and share that information out. And then also they're able to share with their teachers. Let's actually take time and sit as a team, use this tool, break it down to see what are some of our gaps, and then address those gaps based on the needs. And I think that that's important for smaller school districts where they may not have the tools that we do, where we're a school system that educates over 900,000 students and we have thousands of educators on hand. They may have a school system that has, or a town. My family's from a town of less than 1,000 people in southern Mississippi. So, in a school district like that, the need is just as great there as New York. But the fit has to look a little different. As I mentioned, where someone said one size doesn't fit all. It's so true. So it's adjusting, using the assessment tool for the needs of that community.
That's such a great point. One size doesn't fit all. And I loved how you were sharing just within the CARES tool, like there's aspects that can be pulled out and tailored based on the specific group of people that it's being applied to. And the universal aspect of the tool. And I wanted to note too, is like for folks, when we first piloted this tool in this year, we worked with 2 schools in New York City specifically. However, this tool can be used universally, right? It doesn't always have to just apply within New York City. Although we launched it in New York City, this tool is an application that can be applied in all different states, and has the capability to be able to do that. So thank you so much, Dr. Philly, for touching on that point. And also just sharing your experience and expertise on how schools can really start to begin to think about the implementation of the tool within their current mental health practices. So
I
to
can I
wrap us up, oh,
I'm
go
sorry, just
ahead.
share one more other piece. I think it's so empowering that the tool points to the importance of upholding Black girls' agency and their
Mm,
voice, because their voice needs to be amplified and we have to share with them and know your voice matters. We cannot minimize your words. We cannot minimize what you are doing, what you are saying, because if we do it that as they're young, as they're adults, they don't have, they're not showing up. We're not showing up in spaces where we can. I'm grateful that many of us are here and we're showing up. But we have to teach our young girls their voice matters. So that's something else that the tool does.
that's a great point. Thank you for bringing that up too. When we launched the tool with Bella, uh, as well as Prep, this past year, we had our webinar with their school administrators last week. We touched on the wellness teams that we developed, right, in the implementation process. And in the wellness teams, it included their actual students. So Black girls who are in their schools who are going to be utilizing a lot of these mental health programs were a part of the application of the tool. And I think that's something also really unique, what you just pointed out, right? That's another, the guiding principle of the amplification of Black girls' voices and Black girls' agencies, and making sure that they're at the center of what we are doing, because they are being impacted by this, right? And so they should be at the center of this. So thank you so much for bringing that point up. I would like to bring Dr. V back in with us to kind of, close us out. And I I want to really talk about healing, right? Because that is so important in a time we're in now, and I think overall for our communities. and what does it look like, right? And how this tool is really ultimately about healing our communities, and being able to provide the resources and tools for us to be able to really use. So I would love to hear from both of you, and Dr. V, we can start with you first if you would like. How do you all feel within your perspectives? How can we effectively support Black girls within their communities, their families, schools, right? In what ways do you believe the CARES mental health tool can really facilitate the healing process? Dr. V, would you like to start with us?
Yes, I can. Um, I think that's a very thoughtful question. So I think that we see it as a tool, and I actually want to extend on Dr. Farley's point of view, because when I heard her place the tool in context, right? Mississippi is different from, New York. New York is different from, the metropolitan Chicago or suburban area, which is going to be different from LA, right? Or Portland, Oregon, or Eugene, Oregon, places I've served and worked at, as doing this work, doing this gender justice work. So with that in perspective, I want us to, in the audience, because I see them asking questions, the attendees, think of it as a toolkit. This is an entire kit. It's a tool when we think of it, as a single, output, this workbook. But what we offer here, it's a kit. So let's go into our kit, our toolbox, and let's say, you know what? Oh, I have, Tanisha needs this, or the Joseph family, they're asking about this. Oh, my bus driver who is having a difficult time understanding how these Black girls are acting on their bus, right? Or these cafeteria workers who love on our girls sometimes better than our teachers know how to, right? Like, what does this kit look like in your particular social context? So a kit that amplifying and uplifting. But the other thing so that it's the relationships that we can, cultivate within our toolkit, our toolbox. And then I would say this, so that's my educational perspective mind coming in. But I would also say from a clinical perspective, let's not shortchange storytelling. The one thing we know for sure about the therapeutic process is, one, relationships matter, but allowing that person the time and the space and the know-how to tell their story is actually the biggest intervention we can give any human being to recover from toxic chronic stress and racialized and gendered trauma. So imagine just allowing space. And sometimes it is the cafeteria worker. Sometimes it is that grandmother or that play auntie. Sometimes it's the bus driver. Like, girl, she just told me her whole story in this drive, and that in of itself is healing and therapeutic. That's how we can begin to rewire the brain. So I think that the amplification of Black girls' stories is a whole healing
Yeah.
intervention.
Yeah, that's beautiful. Well said. The space, just creating that space alone is the start of that healing process. Dr. Philly, how about yourself? What are your
Oh,
thoughts?
that was beautiful. Thank you, Dr. Evans Winter. I want to share that trust, that it begins with trust. Once you build trust, what I know for sure, I feel like that open, I don't know, the moment, what I know for sure, building trust in the school community and making sure that you build trust with everybody who works there, with everybody who comes through the door, with families. And then we're able to celebrate. You have that trust and the buy-in with them. That can help with amplifying and letting people know that we're able to celebrate and highlight our girls and support them to amplify their voice, to support their agency and what they have to bring, providing opportunities for families to come in and celebrate their girls in STEM. I'm a huge advocate as far as the lack and need for us to amplify and increase the number of Black girls who are entering into STEM careers. the data is there that they lose interest in grade 7 and 9, but it happens before then because they don't hear their voice amplified in that area. So creating spaces where we can highlight, celebrate our Black girls, and also that their families can celebrate them, that they're not just a problem or someone who's there, but they are to be celebrated. That's important through community.
That's beautiful. Thank you both so much. Thank you so much, Dr. V. Thank you so much, Dr. Fairley. Y'all are dropping gems. I hope our audience is taking notes, mental notes, and I hope all of you have gained as much information and resources that have been shared today. And we hope that our two-part webinar series on reimagining educational spaces for Black girls to launch the National Black Women's Justice Institute CARES initiative and this wonderful mental health assessment tool kit, I want to add, thank you, Dr. V, is really helping to kind of spark ideas of collaboration, and spark ideas of thinking of new, innovative, and community-led solutions on how to really address the mental health needs of Black girls. And so I want to thank you all for attending. Apologies if we couldn't get to your questions. I do want to be respectful of everyone's time, and we would love to answer your questions in a post email. And so we are looking forward to collaborating with anyone in the new year who's interested in learning more about this tool, as well as if you just have questions, you can contact myself. My contact information will be on the website. We'll put the website in the chat box for you. And today and moving forward into the new year, the tool is available for educators, for schools, for organizations, available for you to download today, both the workbook with all of the resources that we've been talking about today, as well as the assessments themselves, all available on our website for download. So thank you all so much, and I hope to see you all around soon and hear from folks. Thank you.